Hi, so this is a little recording to just run through what I've discovered about my patients that I've been seeing in the NHS side of my private practice at BMI Hendon and at BMI Blackheath. I have audited my work for the last 5 years. So this is what I found, is that the number of patients that I'm seeing has increased a little towards 2019 and then gone down a bit, obviously, with the pandemic, then back up in 2021 and then down in 2022. But the proportion of musicians in my practice by year was increasing steadily through to 2020 and held pretty much the same for 2021. And for some reason I haven't worked out yet, has gone down in 2022. I now have about 400 musicians that I've treated in the NHS, and I've also got more that I've treated in the private sector over the last few years, and most of them are pianists. Most of my musician patients are seen at Hendon, but I also see some at Blackheath, and I see private patients at Old Broad Street, of course. Guitar, second most common, but I've actually seen about 170 separate pianists now, and a lot of violinists, about 60 violinists as well, and other string instruments, of course. What do I offer them? Generally, a lot of patients get offered a steroid injection in both my musician and non-musician practice. I notice that I offer musicians hand therapy more often than I do to not musicians. I offer local anaesthetic to patients more often if they're not a musician, as well as a general anaesthetic. And then there are other words that crop up in the letters. This is based on a word search from my clinic letters. The word decompression, things like carpal tunnel decompression, come up more often in non-musicians. And then these are the kind of words that come up. They're fairly evenly distributed, and I don't think there's any significant difference between them here. For musicians or non-musicians, I suspect this wouldn't reach significance on a statistical test. And the sort of investigations I send patients for, again, doesn't reach significance, I don't think.